Have you ever wondered what your doctor really thinks when you walk into the room? It's not something most people want to imagine, but the truth is that behind the polite smiles and professional tone, some doctors hold unspoken beliefs about older patients that can shape the kind of care they provide. These views aren't always flattering, and they're rarely spoken about openly, yet they can directly affect how your symptoms are heard, how your treatment is planned, and even which options you're given. In this Wise Living video, we're going to uncover 5 eye-opening truths about what many doctors actually think about older people. But understanding them is the first step toward making sure you get the respect and attention you deserve in every medical setting. Stay with me until the very end, because the final truth might be the one that changes the way you approach your next appointment entirely. Now let's get started. Number 1. They often assume most symptoms are just old age. One of the most frustrating realities many older adults face is that some doctors quickly chalk up their symptoms to nothing more than the natural process of getting older. You might go in complaining of joint pain, fatigue, or changes in memory, and instead of digging deeper, the response can be something like, "Well, that's just what happens at your age." While aging does bring certain changes, this assumption can lead to misdiagnosis and delayed treatment for conditions that are both real and treatable. The danger here is that once a symptom is labeled as just aging, the sense of urgency to investigate further often disappears. That shortness of breath could be written off as a normal part of slowing down, when, in fact, it might be an early warning sign of heart disease. The occasional forgetfulness you mentioned could be passed over as a harmless senior moment, even though it might be linked to a medication side effect or a thyroid problem, both of which can be addressed. By assuming aging is the explanation, opportunities for prevention and recovery are lost. This mindset doesn't always come from malice. Many doctors are under pressure to see a high number of patients in a short period of time, and when they hear a familiar complaint from an older person, it can be tempting to default to the simplest explanation. The problem is that simple isn't always accurate. Treatable conditions like depression, vitamin deficiencies, or early-stage cancers have been overlooked this way, leaving patients to suffer longer than necessary. I once knew an 82-year-old man named Robert who began experiencing extreme fatigue and occasional dizziness. His doctor initially dismissed it as slowing down with age and told him to rest more. It was only months later, after Robert insisted on more tests, that they discovered he had a heart valve problem that could be corrected. Once treated, his energy returned, and he often said he wished someone had taken his first complaints more seriously. It's important for seniors to remember that aging is not a blanket explanation for every ache, pain, or change in health. Yes, the body changes over time, but those changes should be examined carefully, not brushed aside. A persistent cough, unexplained weight loss, or sudden changes in mobility deserve a thorough evaluation, regardless of age. When doctors take the time to look beyond age-related assumptions, they can uncover issues that, if addressed, improve both quality of life and longevity. As a patient, it's vital to speak up, ask questions, and make it clear that you want answers, not just reassurance that this is normal for your age. You deserve the same diligence and investigative effort that would be given to someone decades younger, because your health is just as valuable at 80 as it was at 40. Number 2. They may believe older patients are less likely to follow treatment plans. Another unspoken truth is that some doctors carry the belief that older patients won't or can't follow medical instructions as closely as younger ones. This perception can come from a mix of stereotypes, past experiences, and even unconscious bias. If a doctor assumes you'll have trouble sticking to a treatment plan, they may simplify it in ways that aren't always in your best interest, or they might avoid offering more complex options altogether. While the intention may be to make care easier, the result can be that you receive less thorough treatment than you deserve. This belief often stems from concerns about memory, hearing, or the ability to manage multiple medications. A physician might think, if I give too many details, they'll forget, or if I prescribe this, they'll find it too complicated. While it's true that some older adults face challenges in these areas, it's a mistake to assume it applies to everyone. Many people in their 70s and 80s are fully capable of following detailed instructions, tracking medication schedules, and even researching their own health conditions to make informed choices. When a doctor holds back on explaining the full range of options, it can prevent you from making decisions that might greatly improve your health. For example, a specialist might skip discussing a cutting-edge therapy for arthritis, because they assume you wouldn't want to deal with the extra steps, even if you're willing and able to try. Or they might not fully explain how certain lifestyle changes could work alongside medication to better control your blood pressure. In either case, you're left without the complete picture, and that means you're missing the chance to choose what's truly best for you. I once spoke with a woman named Carol, who was 79 when she was diagnosed with a heart condition. Her first cardiologist gave her a very basic plan, assuming she wouldn't want anything too demanding. Carol, however, wanted to be as proactive as possible. When she changed doctors, her new physician took the time to explain every available option, from medication combinations to diet adjustments and exercise routines. With a more detailed plan, she was able to manage her condition far better than before. This is why it's so important to show your doctor that you're engaged and ready to take an active role in your care. Bring a notebook to appointments, ask for written instructions, and don't hesitate to ask questions if something is unclear. By demonstrating that you can and will follow through, you help break down the assumption that older patients can't handle complex or involved care plans. Ultimately, following treatment isn't about age, it's about willingness, support, and clear communication. When doctors see that you're committed, they're more likely to share every option available, giving you the opportunity to choose the path that offers the best chance for health and quality of life. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any wise living video. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. They may prioritize younger patients in certain situations. It's an uncomfortable truth, but in some cases doctors may unconsciously give more attention or priority to younger patients, especially when time and resources are limited. This bias doesn't always come from a place of disregard. It can be influenced by the belief that younger patients have a longer life ahead and therefore more to gain from aggressive treatment. Yet for older adults, this can mean receiving less urgency, fewer follow-ups, or being overlooked for certain procedures that could still offer significant benefit. In busy hospitals or clinics, when a physician is juggling many patients, they might instinctively devote more time to someone who is 20 or 30 years younger, thinking their intervention will have a greater long-term impact. The problem with this reasoning is that it overlooks the immense value of improving quality of life at any age. A person who is 75 deserves the same chance to feel strong, capable, and pain-free as someone who is prioritizing by age alone fails to consider how much a well-timed treatment can mean for an older patient's independence, dignity, and daily joy. Sometimes, this bias can influence which diagnostic tests are ordered. An older patient might be told that a test isn't necessary because their symptoms are assumed to be part of normal aging, while a younger patient with the same symptoms might be tested immediately. Other times the difference shows up in surgery recommendations, where a physician may avoid suggesting a procedure because they assume recovery will be harder, without asking if the patient is willing to take on that challenge. I remember speaking with a man named Richard, who was 82 when he started experiencing severe knee pain. His first doctor dismissed the idea of knee replacement surgery, saying it was too much for his age. Richard, however, was active, healthy, and eager to stay that way. When he sought a second opinion, the new surgeon evaluated him based on his actual health, not just his birth year. Richard had the surgery, recovered well, and returned to daily walks that he'd missed for years. The takeaway here is that age should be only one factor in medical decisions, not the deciding factor. Your overall health, mindset, and personal goals matter just as much. That means it's essential to communicate openly with your doctor about what you want out of your care. If you feel you're being sidelined or your needs are being placed behind those of younger patients, it's okay to speak up or even seek another medical opinion. By reminding doctors that you value your time, your comfort, and your future, you help shift the conversation from how long will they live to how well can they live. And that change can make all the difference in the care you receive. Number 4, they may see your life goals as less important. Another hidden truth is that some doctors, often without realizing it, make assumptions about what matters to older patients. They may believe that by the time you reach your 70s or 80s, your priorities are limited to comfort and basic health maintenance, rather than pursuing personal goals, hobbies, or new experiences. This mindset can quietly influence the kind of advice and treatment they offer. If they think your only aim is to get by, they might overlook opportunities that could help you stay active, travel, or enjoy the activities you love most. For example, a doctor might hear you mention knee pain and focus solely on managing discomfort with medication, rather than discussing surgical or physical therapy options that could help you return to hiking, dancing, or gardening. Or they might recommend the easiest, quickest treatment instead of exploring more proactive approaches, assuming you're not interested in putting in extra effort for a bigger payoff in the long run. This way of thinking can be especially limiting if you still have clear, vibrant goals for your future. I knew a woman named Ellen who was 81 and dreamed of visiting her granddaughter overseas. She had a chronic lung condition, and her doctor initially suggested she simply focus on staying comfortable at home. But Ellen wanted more than comfort. She wanted to feel well enough to make the trip. When she explained this to a different physician, he worked with her on a targeted exercise plan, updated her medication, and helped her prepare for the travel demands. 6 months later, she was able to make the journey and said it was one of the happiest moments of her life. The lesson here is that your goals matter, no matter your age. Whether you want to keep gardening, join a community group, or take a special trip, your medical care should support those ambitions. If your doctor doesn't ask about your life beyond basic health, bring it up yourself. Share what you hope to achieve and ask how your care can be shaped to help you get there. When doctors see you as a whole person with dreams and plans, not just a patient to keep stable, they can tailor their recommendations in ways that make a real difference. And that can mean living not just longer but better. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any wise living videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 5. They may underestimate the emotional impact of aging on health. While many doctors focus heavily on physical symptoms, some overlook just how much emotional well-being shapes a patient's overall health, especially for older adults. Aging isn't just about joints, blood pressure, and lab results. It's also about adapting to losses, changes in identity, and sometimes living with reduced independence. When the emotional side of health is brushed aside, treatment plans can feel incomplete and leave important needs unmet. Too often, a physician might attribute sadness, anxiety, or withdrawal to just getting older, rather than seeing it as something that can and should be addressed. They may not ask about loneliness, grief, or fears about the future, because it's not part of the standard checklist. But these emotional factors can have a direct impact on physical health, affecting sleep patterns, appetite, immune response, and even how well the body recovers from illness. I remember speaking with a man named Leonard, who had lost his wife of 50. His health began to decline rapidly afterward, but every doctor visit focused on adjusting his medications. No one asked how he was coping or whether he had support at home. It was only when a neighbor suggested counseling that Leonard began to feel like himself again. His physical health improved too, not because his prescriptions changed, but because someone finally helped him address the emotional weight he was carrying. The challenge is that emotional struggles in older adults can be harder to spot, especially if you don't speak up. A doctor might think you're fine because you answer, "I'm okay," when they ask how you're doing. That's why it's important to share what's really going on, even if it feels unrelated to your medical condition. Telling your doctor about feeling down, stressed, or lonely isn't complaining. It's giving them the full picture they need to help you. When the emotional side of aging is ignored, patients can feel unseen and unsupported, which can quietly undermine physical recovery. But when it's acknowledged and addressed, it can lead to better health outcomes, more energy, and a stronger sense of purpose. A good doctor will understand that treating you as a whole person means caring for both your body and your mind. And sometimes a single conversation about how you're feeling can be as important as any prescription. Some of you might be nodding because you've experienced them firsthand, while others might feel frustrated or even a little hurt. But the purpose of sharing this isn't to paint all doctors with the same brush or to make you lose trust in them. It's to remind you that your health and your dignity deserve to be fully seen, respected, and cared for at every stage of life. Knowing these realities can help you step into your appointments with more confidence, ask the right questions, and make sure your voice is heard. Aging doesn't make you less important. In fact, the experiences, wisdom, and resilience you carry are things no lab test can measure, yet they're vital to who you are. You have the right to expect medical care that treats you as a whole person, not just a list of symptoms or a birth date on a chart. And if you ever feel overlooked or dismissed, it's not a sign to give up. It's a signal to speak up, seek second opinions, or find a healthcare provider who values you for the unique individual you are. Over the years, I've learned that the best outcomes in medicine often happen when patients and doctors work as a team. That means being honest about your concerns, asking for explanations when you don't understand something, and remembering that you're an active part of your care, not a passive recipient. And when you approach your health with that kind of mindset, you're far more likely to get the attention, respect, and thorough care you deserve. So as you move forward, carry this knowledge with you. Let it guide you to stronger, more respectful relationships with the people who care for your health. And never forget, your life, your story, and your well-being matter just as much now as they did decades ago. Thank you for joining us today on Wise Living. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.